Okay, so this is Medical Emergencies Part 2. We have emphysema as our first one. So what does COPD stand for? And that is chronic obstructive pulmonary disease. Is emphysema a form of chronic obstructive pulmonary disease? Yes. What effect does emphysema have on the lungs? It destructs the alveoli, the tiny air sacs. What is the leading cause of emphysema? Smoking. What are the common symptoms? Coughing, shortness of breath, and not being able to exercise a lot. What drug would you want to administer to a patient who's having an attack from emphysema? And that's albuterol, because it will open up the bronchioles. What is the maximum amount of oxygen that you would give a patient who's having an attack from emphysema? And that's 2 to 4 liters per minute. What stimulates the reflex to breathe from a COPD patient? That's a low amount of oxygen. What 4 things would you send your classmate for during an emergency? And that is AED, oxygen, emergency kit, and emergency clipboard. What position would you put your patient in that's having an attack from emphysema, and why? It should be upright because it's easier to breathe. What type of vaccinations should a COPD patient have? And that's pneumonia and influenza. How often should we take pulse blood pressure respirations during an emergency? Every 5 minutes. How many cigarettes should a COPD patient be allowed to smoke a day? 0. Where should you document everything that happens during an emergency? And that's in their file, a record of treatment, and then also in the medical emergency form. If your patient is having an emergency, where should you remain until the emergency situation is completely resolved? That's by them. What is the number one thing you can do to prevent an emergency? And that's have a good medical history. Second, we have epileptic seizure. What is happening inside the brain during an epileptic seizure? And that is like brain signals going off. Not really a signal, but just like a disruption in the brain of signals. What is the most common type of epileptic seizure? And that's grand mal seizure. What occurs during the first phase? And that is just a change in personality. Usually people that are like really close to them are the only people that will know that it's happening. And then also an aura, so it can be a smell, flashing lights, something like that. And then what occurs during the second phase? They become unconscious, they pass out to the ground, they get stiff. What happens, and they start seizing. And then what happens during the third phase of the grand mal seizure? They come conscious, and then they're really confused, and just like they're going to be really tired also. What is the petit mal seizure? It's where it usually happens in children, but it's where they become unaware of their surroundings and they're still conscious. Why is a status epileptic seizure so dangerous? And it's because it is so long and it could be very fatal. What is the very first thing you should do when your patient has a seizure? That's called code blue. What are the 4 things you should send your classmate for during an emergency? That's AED, oxygen, emergency kit, emergency clipboard. Your patient is having a grand mal seizure. What position would you place your patient in? And that is, you should lay them back. And why is it important to know your toxic limit for the local anesthetic lidocaine? So the toxic limit is 300 to 500, but it's important to know that because you don't want them to like overdose, or that could also cause a seizure. How often should we take pulse, blood pressure, and respirations during an emergency? Every 5 minutes. If your patient is having a seizure that has lasted for 8 minutes, should you call 911? Why? Yes, because they are having a status epileptic seizure and it lasted for more than 5 minutes, so you want to call 911. What is the most important thing that we can do to help a patient who is having a grand mal seizure? And that is to Get rid of everything around them so they don't hurt themselves. Name 3 drugs that are Name 3 drugs that are commonly used to prevent seizures, and that would be Dilantin, Keppra, and Topamax. And then where should you document everything that has occurred during an emergency? That is in the medical emergency form, as well as their record of treatment in the computer. Let's see. If your patient has an emergency, where should you remain until the emergency situation is completely resolved? And that is by them the whole time. What is the number 1 thing you can do to prevent an emergency? And that's to have a good medical history. Okay. Diabetes mellitus. Where is insulin produced and what is its function? So insulin is produced in the pancreas, and its function is to send sugar to the bloodstream. What is glycogen? So glycogen is that sugar that is stored in the muscles and in the liver. And then why is it important that glucose be constantly provided to the cells of the brain? Because it's the only source of energy to the brain. What type of diabetic requires injections of insulin, a type 1 or type 2, and that would be a type 1. How do most type 2 diabetic manage their disease on a daily basis? That's with diet and medication. What percent of diabetics are type 1 and what percent are type 2? So 15% are type 1 and then 85% are type 2. What causes gestational diabetes? During which trimester does it typically occur? The fetus sends out hormones, and those hormones block the insulin, so that's what causes gestational diabetes, and then it happens during the 2nd or 3rd trimester. What is hypoglycemia, and what are the symptoms? So hypoglycemia means too low blood pressure or blood sugar, and symptoms of that could be they're going to be hungry, they're going to have shakiness, they're going to sweat, they're going to have excess saliva. What would you give a patient who is hypoglycemic? So they don't have enough sugar, so you want to give them candy, cake, orange juice, something like that. What is hyperglycemia and glycemia, and what are the symptoms of this condition? So hyper is high blood sugar, and the symptoms of this condition would be a sweet smell on their breath. They're going to be loss of appetite, and then also it's the opposite basically of hypo, so they're going to have very dry mouth, just very dry. If your patient were conscious and hyperglycemic, what would you suggest to them? So if they're conscious and they're hyper, which means they have high blood sugar, you want to tell them for them to administer their own insulin. You never do it. Okay, and then how often should we take pulse, blood pressure, respirations during an emergency? Every 5 minutes. If your patient is having a diabetic emergency and you are unsure whether they are hypoglycemic or hyper, how would you treat them? You would treat them as a hypo, and you would give them sugar. You would give them sugar. Which patient would better be treated with an injection of glucogen? A hypoglycemic patient or a hyperglycemic patient? Why? Hypoglycemic, because that glucogen is that sugar. So you notice that your diabetic patient has a sweet, fruity, smelly breath. What emergency would you prepare for? And I already said this, it would be hyperglycemic. What should you document? Everything that occurs during an emergency, and that's in the patient's record of treatment and in the medical emergency form. If your patient has an emergency, where should you remain until the emergency situation is completely resolved? That's beside them. And then what are some of the questions you should ask a diabetic patient before beginning their treatment in order to prevent an emergency? You're going to ask them if they ate today, like what they had for breakfast. You're going to ask them if they're type 1, did you take your insulin today? Have you had your insulin? What time? If they've checked their blood sugar, what was their blood sugar? Those type of questions. Okay, last, allergic reactions. What is an allergic reaction? And it is immune response to specific something. So just an immune response. What type of allergic reaction occurs usually within a few minutes, and it may be fatal if not treated promptly, and that would be type 1. What antibody is involved in a type 1 allergic reaction? And that would be the IgE. IgE, yeah. And what does Okay, does an allergic reaction occur the first time a patient is exposed to an antigen? No. And then what effect does histamine have on the bronchioles of the lungs and on the blood vessels? So it causes the bronchioles to constrict, and it causes the blood vessels to dilate. And then how does histamine cause edema and difficulty breathing? So histamine causes the difficulty breathing because the bronchioles are constricted, and then it causes edema because it makes the blood vessels dilate, and that fluid comes out of the blood vessels, and that's what causes the edema, swelling. If your patient tells you that their tongue is beginning to swell and they're itching all over, their throat is beginning to close up, what kind of allergy do you think they're having? And this would be a type 1. What is the first drug you should administer to a patient having type 1 allergic reactions? So you would give them an EpiPen, epinephrine. What 4 things should you send one of your classmates for during an emergency? And that is, you would send them for AED, oxygen, emergency kit, emergency clipboard. Yeah, that's right. And then you have given your type 1 allergic reaction patient an EpiPen and they are still having trouble breathing. What other drug would you give them, and how would you administer this drug? And you would give them, it would be an injection of Benadryl. Okay. I think it's 50 milligrams. Is a type 4 allergic reaction the result of a cell-mediated immune response, or a humoral immune response? And that is a cell-mediated immune response. How often should we take blood pulse, blood pressure, respirations during an emergency? And that would be every 5 minutes. And then what is the number 1 cell involved in a type 4 allergic response? And that is type T cells. What do mast cells cause to be released into the tissues? And that is histamine. What medicines could you use to treat a patient who is having a type 4 allergic reaction? And that's going to be Benadryl, either liquid or in pill form. If your patient has an emergency, where should you remain until the emergency situation is completely resolved? And that is by them the whole time. And what is the number 1 thing you can do to prevent an emergency? That is to keep a good medical history. What is the most effective drug at treating type 1 allergic reactions? Epinephrine.